Did you know that some fruits, yes, fruits, can actually speed up aging, damage your brain, and spike your blood sugar worse than a can of soda? According to a 2023 study in the Journal of Clinical Nutrition, adults over 65 who regularly ate specific high-sugar fruits had a 57% higher risk of developing metabolic syndrome, which is a dangerous condition linked to stroke, diabetes, and heart failure. The scariest part? These are the very fruits marketed as healthy or good for digestion, but they could be quietly damaging your body every single day. If you're over 65, your metabolism is slower, your cells are more vulnerable, and your tolerance for sugar drops dramatically, meaning the wrong fruit can do real harm fast. But there's good news too. Some fruits are like natural medicine for seniors. They help lower blood pressure, strengthen your heart, and even make your brain literally much younger than your age. In this video, we're revealing the 4 fruits seniors must eat every day and the 4 they should avoid at all costs. And don't miss the final one on the danger list. It's sweet, juicy, and loved by millions, but it could be silently draining your energy and shaving years off your life. Before we begin, let us know in the comments below where you're watching from. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's get started. Number 4. Avocados. Yes, avocado is technically a fruit, and it deserves a special spot here for good reason. Contrary to outdated nutritional advice that warned against all dietary fats, avocados are one of the most beneficial foods seniors can incorporate into their diets. What makes avocado so unique is its high content of monounsaturated fats, primarily oleic acid, which has been shown to significantly reduce dangerous LDL cholesterol levels while improving the levels of good HDL. This specific fat profile makes avocados extraordinarily valuable for seniors managing cardiovascular concerns, as improved cholesterol ratios translate directly to reduced risk of heart attack and stroke. But that's just the beginning. What many seniors don't realize is that avocados contain more potassium than bananas, approximately 975 milligrams per fruit, making them exceptional for blood pressure management. This is especially important since hypertension affects nearly 2 to 3 of adults over 65. The potassium in avocados works by counterbalancing sodium intake and relaxing blood vessel walls, naturally bringing blood pressure readings into healthier ranges without additional medication. Beyond cardiovascular benefits, avocados provide substantial amounts of lutein, which is an antioxidant carotenoid that has been shown to improve eye health and reduce the progression of age-related macular degeneration, a leading cause of vision loss in seniors. But perhaps the most underrated benefit of avocados is how well they support nutrient absorption. Many of the vitamins and antioxidants in vegetables, like vitamins D, E, and K, are fat-soluble, meaning your body needs fat to absorb them. Eating avocado alongside a salad or cooked greens can increase the absorption of these vital nutrients by up to 15 times. That's a huge boost for anyone trying to get the most from their meals without taking handfuls of supplements. So how can you get all these benefits? Well, 1/2 of an avocado a day is enough to reap the benefits. Spread it on whole grain toast, mix it into a smoothie, or just eat it with a spoon and a dash of lemon. However you enjoy it, this fruit truly is a game changer for senior health. Number 3. Apples. Apples are incredibly rich in fiber, particularly a type called pectin, which feeds the good bacteria in your gut. A healthier gut leads to better digestion, stronger immunity, and improved nutrient absorption, which are 3 things that become increasingly important as we age. But what makes apples even more impressive is their effect on cholesterol and heart health. Pectin binds to cholesterol in the digestive tract and helps remove it from the body, effectively lowering your LDL cholesterol levels over time. Apples also contain flavonoids like quercetin, which reduce inflammation and support cardiovascular function. And let's not forget their role in blood sugar regulation. Despite their sweetness, apples have a relatively low glycemic load, and their fiber slows down the absorption of sugar into the bloodstream, preventing spikes and crashes. For seniors with insulin resistance or type 2 diabetes, this can be incredibly helpful. Apples are also incredibly filling, thanks to their fiber and water content, making them great for appetite control. And here's something few people know. Chewing apples stimulates saliva production, which helps reduce the risk of cavities and gum disease, issues that become more common with age. Red, green, or yellow apples are one of the most accessible, versatile fruits, and adding just one to your daily routine can support nearly every major system in your body. Number 2. Pomegranate. Pomegranate may not be the first fruit that comes to mind when you think of daily snacks, but for seniors, this ruby red fruit is like liquid gold for the heart. As we age, our arteries naturally begin to stiffen, and this can reduce blood flow, elevate blood pressure, and place more strain on the heart. What makes pomegranate special is its rich supply of punicalagins, a type of antioxidant that's so powerful it can reduce oxidative stress in the arteries by over 30%, according to studies published in the journal Atherosclerosis. In fact, studies show that punicalagins may have up to 3 times the antioxidant activity of red wine or green tea. When oxidative stress builds up, it causes the walls of your arteries to become inflamed and narrow, kind of like rust in an old water pipe. Punicens help clear that out, making blood flow smoother and easier. Plus, pomegranate juice has been shown to lower systolic blood pressure by 5 to 21% in people with hypertension, which is a big deal for seniors trying to manage their blood pressure without increasing medications. But that's not all. Pomegranate also supports memory and brain function. In one UCLA study, older adults who drank pomegranate juice daily showed significant improvements in verbal memory tests compared to those who didn't. This is crucial because memory loss is one of the most feared effects of aging. For those concerned about dental issues, pomegranate juice offers most of the same benefits without requiring chewing. Even the concentrated antioxidants in supplement form have shown promising results, though whole fruit consumption provides additional fiber and micronutrients. Now here's the thing. You don't need to drink a whole glass every day. Even just eating half a cup of the seeds or mixing a splash of the juice into your morning smoothie can deliver major benefits. And unlike many sugary fruits, pomegranate has a low glycemic index, meaning it won't cause sharp spikes in blood sugar. That's perfect for seniors with prediabetes or type 2 diabetes. Just make sure you're choosing 100% pure pomegranate juice with no added sugars. And if you're on blood thinners, always check with your doctor first because pomegranate can slightly interact with certain medications. But overall, this fruit isn't just good for you. It could literally help extend your health span by keeping your heart younger longer. Number 1. Berries, blueberries, raspberries, and blackberries are at the top of our list of beneficial fruits for seniors, as they collectively offer the most impressive group of age-defined properties of any food. What makes berries uniquely beneficial for seniors is their specific impact on cognitive function and brain health. These little gems are loaded with anthocyanins, which are natural plant compounds that not only give blueberries their vibrant color, but also act as powerful antioxidants. When you eat berries, these compounds go to work by reducing inflammation in the brain and improving communication between brain cells. In fact, groundbreaking research published in the Journal of Annals of Neurology found that seniors who consumed just 2 servings of blueberries per week had measurable delays in cognitive aging by up to 2 and 1 to 2 years. This means they essentially maintained the cognitive function of someone 2.5 years younger. This brain protective effect appears linked to berries' unique ability to cross the blood-brain barrier and directly neutralize oxidative damage in brain tissues. And the benefits don't stop at memory. Blueberries also improve balance and coordination, which is a big deal for preventing falls, a leading cause of injury among seniors. The cardiovascular benefits of regular berry consumption are equally impressive, with multiple studies showing significant reductions in blood pressure, improvements in arterial flexibility, and decreased markers of inflammation among older adults who incorporate berries into their daily diets. These effects translate to measurable reductions in heart disease risk, which is particularly important since heart disease remains the leading cause of death among seniors. Beyond these major benefits, berries offer exceptional blood sugar management properties, with the fiber and bioactive compounds helping to steady glucose levels after meals, preventing the dangerous blood sugar spikes that can exacerbate diabetes or pre-diabetic conditions common in older adults. The fiber content in berries, approximately 8 grams per cup, also supports digestive health and promotes regular bowel movements without irritating sensitive digestive systems. Just 1 cup a day, whether added to oatmeal, yogurt, or a smoothie, can make a noticeable difference in energy, focus, and even mood. Just make sure you're going with fresh or frozen blueberries and skip the dried ones, which are often loaded with added sugars that cancel out the health benefits. Now that we've uncovered the top 4 fruits seniors absolutely should be eating, let's dive into the 4 fruits seniors should never touch, starting with one that might already be hiding in your kitchen. Number 4. Grapes. At first glance, grapes seem like a harmless, even healthy snack. They're small, sweet, and refreshing, often touted as a good source of antioxidants, especially red or black varieties. But for seniors, grapes can be deceiving. One of the biggest concerns is their extremely high sugar content paired with a very low fiber load. Grapes contain a type of sugar called glucose fructose, and because they're so easy to pop into your mouth by the handful, it's incredibly easy to consume far more sugar than you realize. In fact, just 1 cup of grapes can contain 23 grams of sugar, about the same as a small candy bar. For older adults who may already be dealing with blood sugar management issues, this can spell disaster. The lack of fiber means the sugar gets absorbed rapidly into the bloodstream, leading to spikes in blood glucose and insulin. These fluctuations are more than just temporary. They're linked to weight gain, inflammation, and increased risk of type 2 diabetes. Another issue is that grapes are often coated with pesticide residues if not bought organic, and seniors with weakened immune systems or sensitive digestion may be more vulnerable to those toxins. Even the skin of the grape, while thin and easy to chew, offers minimal nutritional value compared to the skin of other fruits like apples or pears. So the bottom line, grapes may seem innocent, but they're a blood sugar disaster in disguise, especially dangerous for seniors trying to maintain stable energy, weight, and metabolic health. Number 3. Dried fruits. Dried fruits, particularly those commercially processed with sulfites, represent one of the most problematic fruit choices for seniors, despite their seemingly wholesome nature and convenience. The most immediate concern with dried fruits lies in their extraordinarily concentrated sugar content. When water is removed during the drying process, what remains is essentially fruit sugar in highly concentrated form. A small handful of dried apricots, for example, contains approximately the same amount of sugar as eating several whole fresh apricots, making it extremely easy to consume excessive amounts of fructose without the fiber and water content that would normally provide. Satiety signals. This sugar concentration is particularly dangerous for seniors managing diabetes or insulin resistance, as it can cause dramatic blood glucose spikes even when consumed in small quantities. Over time, this can lead to type 2 diabetes or make existing diabetes much harder to manage. But the damage doesn't stop there. These sugar spikes also increase inflammation in the body, which can worsen arthritis pain, accelerate cognitive decline, and even weaken the immune system, which is something seniors cannot afford to compromise. And to make matters worse, commercially produced dried fruits frequently contain added sulfites, which are preservative chemicals used to maintain color and extend shelf life. These sulfites can trigger severe asthmatic reactions in sensitive individuals, with seniors being particularly vulnerable due to age-related changes in respiratory function, as well as an increased prevalence of asthma and COPD in older populations. Approximately 1 in 100 people have sulfite sensitivity, but this number increases significantly among seniors with respiratory conditions. The inflammatory potential of both the concentrated sugars and chemical preservatives in dried fruits makes them particularly inappropriate for seniors managing inflammatory conditions such as arthritis, which affects nearly 50% of adults over 65. Number 2. Unripe bananas. While ripe bananas with brown spots can be a nutritious option for many seniors, unripe or green bananas present several significant health concerns that make them one of the worst fruit choices for older adults. The primary issue with unripe bananas lies in their high resistant starch content. Unlike the easily digestible sugars found in ripe bananas, this type of starch resists digestion in the small intestine. For seniors already experiencing age-related digestive changes, such as decreased digestive enzyme production and slower gut motility, this resistant starch can cause significant gastrointestinal distress, including bloating, gas, and abdominal pain. The problem is exacerbated in seniors with irritable bowel syndrome or inflammatory bowel conditions, which become increasingly common with age. The difficulty in digesting unripe bananas extends beyond discomfort. It can actually impair nutrient absorption from other foods consumed during the same meal. This is particularly problematic for seniors who may already be struggling with nutrient deficiencies due to medication interactions, reduced appetite, or age-related changes in nutrient absorption efficiency. Other than that, the astringent compounds in unripe bananas responsible for their characteristic chalky mouthfeel can also irritate the digestive tract lining in sensitive individuals, triggering inflammatory responses in the gut. From a nutritional perspective, unripe bananas contain significantly lower levels of antioxidants compared to their ripe counterparts, as these beneficial compounds increase dramatically during the ripening process. For seniors seeking the anti-inflammatory benefits of fruit consumption, this reduced antioxidant content makes unripe bananas a particularly poor choice. Number 1. Grapefruit. At the top of our list of fruits seniors should avoid is one that might surprise many: grapefruit. Despite its reputation as a health food and weight management aid, grapefruit poses potentially life-threatening risks for seniors taking certain medications. The danger lies in compounds called furanocoumarins, which can inhibit the production of an enzyme in your intestine called CYP3A4. This enzyme is responsible for metabolizing approximately 85 different medications. When this enzyme is inhibited, medications can reach dangerously high levels in the bloodstream. It's like getting a much higher dose than prescribed, even though you took the correct amount. This can dramatically increase the risk of side effects, some of which can be serious or even life-threatening depending on the medication. The list of medications affected here is extensive and includes some very common ones prescribed to seniors, such as certain statins used to lower cholesterol like atorvastatin, lovastatin, and simvastatin, some blood pressure medications like certain calcium channel blockers like mifepristone, anti-anxiety drugs like buspirone, anti-arrhythmia drugs like amiodarone, and even some antihistamines and immunosuppressants. For example, consuming grapefruit while taking the statin Lipitor can increase the drug concentration in the bloodstream by over 400%, dramatically raising the risk of serious side effects including muscle breakdown and kidney failure. Even more alarming is that these interactions don't require consuming large amounts of grapefruit. Just half a fruit or a small glass of juice can be sufficient to trigger dangerous interactions, and the effects can persist for up to 72 hours after consumption. So simply spacing out your medication and grapefruit intake doesn't solve the problem, because the potential for interaction is so significant and involves so many common medications vital for managing senior health conditions. Grapefruit takes the top spot on our list of fruits to avoid or approach with extreme caution. If you take any prescription medication, it is absolutely essential to talk to your doctor or pharmacist specifically about whether it's safe for you to consume grapefruit or grapefruit juice. Don't assume it's okay. The risk of amplifying your medication's effects or side effects is simply too high to ignore. It's a seemingly innocent fruit with a hidden, potentially dangerous interaction potential. So there you have it. The full breakdown of fruits seniors should be reaching for and those they should leave on the shelf. The good ones like avocado, apples, pomegranates, and berries can literally help you age slower, think clearer, and feel stronger. But the bad ones, like grapefruit, dried fruits, unripe bananas, and even innocent-looking grapes, can quietly steal your energy, spike your blood sugar, and increase inflammation that puts your health at risk. The scary part is how subtle it all is. Most people have no idea a handful of grapes or a ripe banana could be setting off a cascade of issues inside the body until it's too late. So, choose wisely, eat mindfully, and always pair your fruit with protein or healthy fat if you can. Now we want to hear from you. Have you been eating any of these bad fruits without knowing the risks? Which one surprised you the most? Have you ever had a surprising reaction after eating a certain fruit? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.